I attended a 2-day event for the International Classifications of Framework designed to develop the course sets for deafblindness. Deafblind participants, researchers and committee members and professionals from around the world came together to meet in person. The focus was to discuss and vote on the course sets remaining in agreement. The course set will be a useful tool to assess and improve services and support systems, including the NDIS, the National Disability Insurance Scheme. It will also provide detailed information on the factors that impact deafblind people, including activities, social situations, and the environment. It was a challenge travelling to a different country. There were places that were dark, little light, and signs. The roads had uneven surfaces, narrow roads, and many hills. The support worker helped me travel to places safely, providing me information of the surrounding environment. The interpreter helped me bridge the communication gap with people. Many people spoke limited English, and there were signs and information in Spanish language. We needed to use a Google translator to know what we were eating in a restaurant. The interpreter also supported me in the conference with providing me information and the surrounding environment to make me feel more inclusive. The ICF course set will help many countries that don't have support systems and policies on deafblindness. It will give people with deafblindness the support they need for basic living standards. Australia will use this framework to improve services, communication access, and reduce isolation. It also supports the World Health Organization guidelines as an international standard for describing and measuring health and disability. The global deafblind community had a shared goal, was to improve the lives of deafblind people. It gave me a strong sense of belonging with sharing our experiences and knowledge. I was able to see the differences in culture, language, and the support systems that affect the lives of people with deafblindness. I now appreciate that Australia has a world-class support system that helps many deafblind people. Many countries like India have limited funding and resources to support the large population and many different communities. The supporters and professionals were passionate about learning and fully committed in improving services and supports to deafblind people. For example, in Sweden, there's limited funding for services such as interpreters and support workers, which is very different to the service systems we have in Australia. I would like to say special thanks to Census WA, Meredith Prain, and Deafblind Australia and the board for your financial contribution to enable me to attend the ICF conference in Spain. I would also like to acknowledge Walter Watich and the team for the work on the ISCF framework on deafblindness, and look forward to seeing it endorsed worldwide.